Good morning, everyone. In this video, we presented our preferred practice pattern lockdown based on expert under the leadership of AIOC. All point of entry screening and sanitization measures should be continued. Disposable 3-ply masks for all patients, attendants, and healthcare workers who come in direct contact with patients is mandatory. All waiting hall precautions with proper spacing should be continued. All patients visiting the hospital for any purpose should give a written consent in prescribed AIS format. If feasible, remote patient check-in and payment should be done. Online appointments and offline appointments to be spaced out to avoid hall congestion by using EMR. Vaccination is a mandatory for all healthcare workers, and patients visiting the hospital should also be encouraged to get vaccinated. Instrument cleaning protocols on individual patient basis should be followed. Minimum conversation with patients or colleagues should be done. For a patient with suspected COVID-19, use a separate OPD room with an isolated waiting area. Sanitize the room after patient exits, and the next patient to be examined after 20-minute gap. Staff should change gloves for each examination. The OPD room should not be with positive pressure. N95 masks to be provided for healthcare workers engaged in patient examination and management. All slit lamps should have breath shields. Any patient with conjunctivitis to be taken directly to an isolated room and be directly seen by a doctor wearing a PPE, and no other test will be done. If the redness is not due to conjunctivitis, they will join the other patients for examination and treatment. Prescription of patient should directly reach pharmacy to minimize contact. One patient should be attended at a time. Optical frames should be disinfected in UV chamber after each trial. In addition to routine counseling, counselors should also explain COVID-19 operating room protocols to the patients. OPD premises should be mopped every 2 hourly and disinfected with UV light every week. OT entry screening and sanitization measures should be strictly followed. If possible, rapid COVID-19 antigen screening tests can be done. Standard pre-operative cleaning protocols should be maintained along with disposable 3-ply mask and cap. All necessary preparations should be done prior to the entry of patient.
I am in some conference. You talk to the counter.
Part preparation and surgical draping should be done properly. We recommend double-layered surgical drape over linen draping. If OT has been unused for a prolonged time, that fumigation as negative cultures from standard location surgery. Minimal OT personnel will minimize the risk of exposure. All the equipment should be cleaned and disinfected as per manufacturer's recommendations. Waste disposal should be as per norm. The table should be disinfected after every surgery and try to have spacing of minimum 20 minutes between 2 surgeries. The fight against COVID-19 appears to be a long one. Using preferred practices as far as possible will help us to prevail in this difficult time. Thank you.